Joining me now is our rapid response panel, Ruth Conniff of the Progressive Magazine, and also the Griot contributor, Zerlina Maxwell. This is the day we all been waiting for. Actually, I have to start with, well, I'm waiting for the death panel stories. I'm waiting for the right-wing media out there to put everything on the death watch, because we've heard so much garbage about the bad stuff. We are now functionally changing in this country. Zerlina, what does this mean to women? Because when it comes to price, when it comes to paying, when it comes to the cost, it's been a different world for women until today, hasn't it?
Absolutely, and I think this is the end of codified gender discrimination, which is what the old system was. It meant that a woman, when we're really talking about women over the age of 26, under the age of 26, you can stay on your parents' insurance. So we're talking about women at their prime reproductive age, and now they're able to get affordable health care and everything that they need covered. That is life-changing, and I'm one of the 2.1 million Americans who signed up for a private health insurance plan, and my life is going to be completely changed because I have affordable health care.
As far as the women who are being affected by this, Ruth, isn't that this the aspect of the law that really has been overlooked, and hasn't really been a whole lot of focus on this?
It's true. I mean, one of the things that the Affordable Care Act does is it says that being a woman is no longer a pre-existing condition for which your health insurance company can charge you quite a bit more. And in fact, women on average were paying up to 150% of what men were paying because they were women. And the fact that that's illegal now, you can't charge women more because they're women. And in addition to that, you have to cover newborn care, maternal health. Women are going to be able to get birth control coverage now that they couldn't get before. All of that is incredibly significant. Cancer screenings, really important primary health care. And for those women who are under the age of 26, and I have 3 little girls, and I think about this, the fact that they can stay on their parents' health insurance means that young women in their early 20s who really do not want to have an unintended pregnancy that can upend their life are on health care, they are seeing a doctor regularly, they can get birth control, and they're not in that gray zone that can really ruin women's lives. I think it's a huge step for women.
Lots of conversation about what Michael Moore has done when it comes to health care, because he did a documentary on it. But now he has written, I think, an op-ed which has thrown a lot of people for a loop. He wrote in the New York Times saying that Obamacare was awful. Saying that there's the dirty little secret that liberals don't want to talk about. You know, I have a real issue with this. I think he's a great guy. I think he's done a lot of great things. We all want universal health care. There's no question about that. But how can it be awful with the things that we're talking about right now? Zerlina?
Well, I just think that this is, the number one thing that I thought when I read his op-ed was not helping. I think that, the polling has really been misleading all along, and Michael Moore is evidence of this. He's someone who wanted single payer, and so he would be among those that is polled and disapproves of the law. It's the right-wing talking point that the majority of Americans disapprove of the law, but you wouldn't think of Michael Moore and Ted Cruz both being aligned in disapproving of the law. But that's exactly what's happening here, and it really has hurt, I think, the PR push that the White House has been trying for many, many years up against millions and millions of dollars in misinformation. And I think it actually damages the long-term outlook to attack the law. And I felt the same way when everybody was attacking the website, as if the sky was falling and it was the be and end all of the policy. And so I think that what we need to be focusing on now in 2014, particularly going into the midterms, is that this is going to change millions and millions of lives, right? So the number we're talking about here is 9 million people whose lives are changed, and Democrats need to go on offense and really focus on the difference in the quality of life for those folks, because it will be very significant.
Well, let's talk about the land where there's radical governors. One of them is in Wisconsin. Is it safe territory to go on the offensive for Obamacare in the middle of the country, Ruth? What about it?
Oh, absolutely. If you want to talk about a healthcare mess, all you have to do is look at Wisconsin, because Wisconsin not only refused to take the Medicaid expansion, but curtailed its own Medicaid expansion program called Badger Care, so that now a lot of working poor people who used to have health care in this state are getting kicked off. And what the governor has said to them is, well, you can get health care on the private market now because of the Affordable Care Act. Well, if they had the Medicaid expansion, it would be free. Now they have to spend money on it. And Republicans in our legislature have argued, look, it's wonderful. You have an opportunity to buy for thousands of dollars a health care policy when you're only making $12,000 a year. So it's really obnoxious. It's costing us more money to insure fewer people, and people in Wisconsin recognize that we could be insuring more people and spending less tax money.
See, now, Ruth, what you just described, that is awful. And that's what Michael Moore ought to be writing about. It's awful that universal health care was not at the table. Universal health care was never given a seat by Senator Max Baucus of the Senate Finance Committee. That's the awful part.
Right.
But the things that we're talking about right now and the things that are actually happening yesterday and today as we move into the full implementation of Obamacare, no, it's not a dirty little secret, and it is not awful. And I take issue with what Mr. Moore was writing about in the New York Times. I think he's off base. What's awful is these right-wing Republican governors that are denying their own citizens a chance to get health care. That's the awful part of it all. Zerlina Maxwell and also Ruth Conniff, great to have you with us tonight. Thanks so much. Next up, the